Have you ever gone to a doctor with a simple fever and realized that you pay thousands in extra cash just to get a simple blood test done? The doctor interrogates you with a few more questions, puts the hand on your stomach, and presses in a weird way which only gives you more pain. And then he hears your heart and your lungs through a stethoscope and tells you, "Hey Rahul, you may need an additional blood test." Why do doctors order these seemingly unnecessary but costly tests? Is it for a fancy commission? By the end of this video, you will not only learn how to save more money, but also begin to trust your doctor even more. So do watch this video right at the end. So a lady went to the doctor one day and said that, "Doctor, I'm feeling a bit dizzy and I occasionally have some blackout episodes." Two things came in the doctor's mind. One was low blood sugar levels and the other was low hemoglobin levels, and put the patient for blood tests. In the blood test, it was found out that the kidneys were not functioning properly, and on further investigation by the hematologist, they realized that she was suffering from antiphospholipid antibody syndrome. Essentially, her blood had become abnormally thick because of a very abnormal physiology of the body. Because of this blood thickening, there were so many clots all over her body that a small part of the clot had actually come out, what we call as an embolus, and had gone to her eyes, and that was giving rise to the blackout attacks. The patient was immediately treated for this particular condition, and that saved her life, because if this disease progressed right up till its fag end, it can also give rise to stroke, which can be absolutely detrimental to the patient. So simple dizziness, which we usually attribute to dehydration, to low sugar levels, to low hemoglobin levels, turned out to be a life-threatening condition, and only a blood test in this case saved the patient. So the number one reason why doctors order these blood tests is to differentiate between common diseases which require common drugs and severe life-threatening diseases which require more aggressive drugs. You and your friend both have fever, and your friend tells you that he went to his family physician and got a simple paracetamol and his fever came down. The same evening you go to your family physician because of the fever, and he tells you to get an additional dengue and malaria test. And you walk out of the clinic thinking, is this doctor just trying to rip me off? Or is he getting a fancy commission from the pathology lab? But what you probably missed was that when you're telling him where you live, he automatically came to know that you're staying in a construction area. You're staying in an area where there's probably a slum that is 200 meters away, and there is recently has been a dengue or a malaria outbreak over there in that area, and that is why quickly to his mind he's thinking dengue, malaria, I should get a blood test and start her treatment aggressively, because otherwise she can go into the complications of dengue and malaria. I need to save her. The second reason why doctors order blood tests is because they are your friend, philosopher and kind. They see you totally as a whole person. Every patient is different and the same symptom can arise from multiple diseases, and that's why he needs a blood test to know what exactly you are suffering from. Mukesh is a businessman, and due to a very stressful and hectic and sedentary lifestyle, he develops diabetes mellitus. He goes to the doctor that puts him on a very common drug in diabetes known as metformin. He comes for routine checkups every 6 months and everything is normal. His sugars are normal and under control because he is compliant with metformin. Suddenly, in one of those routine checkups, the doctor sneaks in a kidney test and tells Mukesh to get this done from the nearest pathology lab. Now Mukesh is slightly skeptical. Why this additional blood test when my sugar levels are absolutely normal? This is because although diabetes is controlled due to medications, over several years it can cause kidney damage. So the doctor simply wanted to check that. But it does not end over there. Remember the drug metformin that I spoke about? If the kidneys are not excreting the drug properly, this metformin, which is a synthetic compound, can accumulate in your body and can cause a lot of toxic effects. So you need a normal functioning kidney to excrete metformin, and hence during a simple routine checkup for diabetes, your doctor may advise several other tests to check whether the drug is being excreted, whether the drug is being utilized by the body properly, or whether there are any toxic effects of the drug on your body. Similarly, there are many drugs for which there are well-researched, well-documented side effects. For example, a very common anti-tuberculosis drug is isoniazid, and that is extremely notorious to damage your liver. And that's why the government of India has made liver function tests free for all TB patients, because it is such a documented and researched side effect that we have to catch patients early and we have to change the course of medication. Please remember that a normal blood test does not mean that you did not need the blood test. There was no way a doctor could know this about you without ordering blood tests, and I'm sorry, we don't have any supernatural powers to diagnose every disease based on history and examining you. For example, if a tuberculosis patient denies liver function tests because he thinks that it is unnecessary, a few months down the road he may report in the emergency department with liver failure, and that may require aggressive treatment, not even mentioning a liver transplant, and he would lose more money and more trust in the doctors. The third reason why a doctor may order additional blood tests is because although your symptoms may be controlled by medication, the disease itself can cause damage at a cellular, biochemical, and at a microscopic level which only a blood test can diagnose, and there are many drugs which cause side effects, documented side effects, and we have to stop you on the drug if it actually manifests and damages your vital organs like your kidneys, your liver, and also your heart. Overall, blood tests are required to be sure of the clinical diagnosis, to rule out other horrible, life-threatening diseases, for documentation purposes, for medical legal purposes. The correct blood test at the correct time for the correct person will not only save money going down the road, which prevents diseases from going into complications and you needing additional costly drugs which can hamper not only your bank account but also your energy, your time, your mood, and your overall lifestyle. Next time when you go to the doctor, just ask him politely, why is this blood test being required? What is there in the doctor's mind? What does he want to rule out? A doctor will really appreciate when the patient asks such smart questions and wants to know more about the case. It should not be a service where the patient comes, tells so and so symptoms, and the doctor prescribes a medication. It should be a dance. It should be a conversation between the patient and the doctor. What the patient is going through objectively and subjectively, so that the treatment outcome is ultimately best for the patient. That's it for this video. It was the first video in a new series that I'm starting called Understanding Doctors, which is essentially trying to build bridges between the doctor and the public so that there is more trust in medicine, more trust in doctors, which leads to less violence on doctors, a better patient outcome. I firmly believe the relationship between a doctor and a patient is that of a friend, philosopher, and a guide. So this is my small contribution to improve the doctor-patient relationships that we know is under threat today. Do share this video with your non-medical friends and your family WhatsApp groups. I'll be sure to respond to all your comments down in the comment section below. And if you personally enjoyed this video, do subscribe to the channel. I'll see you in the next video. Bye bye.